Today I'm going to be talking about immunotherapy. When I first found out we were moving to Alaska, I wasn't exactly thrilled to be living thousands of miles from our family. So I got the notion after a few weeks of being here that I could have some environmental allergies. I got a nurse at the ear, nose, and throat clinic here in town as the allergy nurse and decided to test myself for allergies. Come to find out, I am completely allergic to Alaska. Immunotherapy involves injecting patients with allergens that they have responded positively to in allergy testing in hopes that we can desensitize the immune system to those allergens. I've been an allergy nurse for about 8 months now. I had training in allergy testing and mixing allergens from a nurse practitioner who's been working in the field for about 15 years now. Also do research myself on a weekly basis to keep up with best practice in the field. Many people have at some point in time experienced some allergic reactions to at least one type of antigen. These allergic reactions include things like itchy eyes, runny nose, sneezing, coughing, things like that. Have you ever experienced any type of allergic reaction such as any of these? And have you ever been allergy tested? Immunotherapy and allergy testing can really benefit those of us who experience allergic symptoms and can overall better the quality of life. So first of all, we'll start off with the immune system. The immune system is designed to fight off foreign invaders that enter into our body. Antigens are these foreign invaders. So author John Krause, he's the author of Allergy and Immunology and Otolaryngologic Approach, states that an antigen is any type of foreign object that provokes an immune response. Specifically, the production of antibodies. Antibodies are the good guys of the immune system, whereas antigens are the bad guys. Antibodies help us fight off things such as viruses and bacteria. Unfortunately, for those of us who have allergies, the antibodies sometimes recognize things such as tree pollen, weed pollen, mold spores as foreign invaders. And although they are foreign invaders, they're really somewhat harmless to our bodies, but they recognize them as harmful. So anyway, that's when we experience those allergic symptoms. If you have any of these experiences with allergies, you're going to meet with an otolaryngologist. You're going to talk to the otolaryngologist about symptoms, how often you're having these symptoms, what type of medications you find relief with, if any, and then he's going to decide if you're a good candidate for allergy testing. From there, once we decide to move forward with allergy testing, you'll come to the clinic and the allergy nurse will begin that process. The allergy testing is done with a small device called a prick. On the end of the plastic prick are tiny teeth that hold just a drop of the allergen. And depending on what part of the country you live in is what decides what type of allergies we're going to be testing for. So in Fairbanks, Alaska, where I live now, we test for 32 different type of environmental allergens. Now each part of the country is probably going to do the same when it comes to weeds, trees, molds, and then a miscellaneous, but the type of trees, the type of weeds are going to be specific to your area. Once those allergens are placed on your back with the prick, it's just a small scratch that just introduces the allergens to the skin. We'll have you wait for 15 minutes to give your body a chance to react. After 15 minutes, the nurse will come back in and will be able to assess any positive reactions that you've had. The positive reactions are presented as a red area, which we called erythema, and a small bump that resembles a mosquito bite, which we call a wheal. All of this will be documented, presented to the physician, and then he'll discuss with you if immunotherapy is a good option. When we decide to move forward with immunotherapy, the nurse will reference your allergy test and see what allergens you had a positive response to. These are the allergens that will be placed within the vial that you will be injected with. We're going to start with a weaker solution of the allergens that are diluted down with a sterile diluent. It's usually like a saline or something of that nature. Over a period of time, we're going to gradually increase the dilution. So after about 9 weeks, we're going to be at a more concentrated solution of the allergens. We do this so that we don't overwhelm the immune system with the antigens. Author Houston King, who wrote the book Allergy and ENT, states that after about 12 months of immunotherapy, patients should see a drastic change in their allergic symptoms. We have patients come in that state less use of antihistamines, less use of medications such as Claritin, Allegra, things like that. Immunotherapy is a great option. It is a very in-depth biological process, but it's a great option for those of us who have these bothersome allergic symptoms and can provide us with a better quality of life. Although I will not be leaving Alaska anytime soon, I do have hope with immunotherapy that I can bear this beautiful cold state without the itchy eyes and the runny nose.